And we are back here on this Thursday morning, and now it's nice and quiet. Maybe the boys will be quiet so we can do a serious interview. Dr. Lawrence with me this morning. How are you?
I'm fine, but I doubt it'll be quite as entertaining as the last time.
I don't know. I bet you could probably hold your own. They're trying to get all the smoke out of the kitchen from burning cookies, which, by the way, I did not do, for the record. Need to tell it rat out, Jeff, this morning. Well, I hope this has been somewhat entertaining for you, but we're not here to talk about us. We're here to talk about you. New place to work, and tell me a little bit about yourself.
My name is William Lawrence. People call me Bill. I grew up in South Mississippi. A friend of mine from residency, Dr. Patrick Boyette, and I decided last summer that we wanted to work together and relocate to Athens. He started August 15th. I started January the 3rd of this year. Our clinic is at the corner of Lindsay Lane and Highway 72 in the Medical Village building of the hospital.
Specializing in?
Well, we're general orthopedics. We do everything in orthopedics with the exception of spine work.
Okay, well, that's a broad, that's a full range of things, different things that you do. Are patients referred to you, or if they just have an injury or some pain, can they call you up and make an appointment?
They can call. There's very few insurance plans today that you have to have a pre-cert or a referral from a primary care doctor. So they're more than welcome to call our number at 256-233-2332.
Okay, what are the hours there?
8:30 till roughly 5 most days. We'll generally stop new patient appointments and follow-up appointments around 4:30.
Okay. You know, recently I had someone tell me, or a lady that I know is going through, she had recent hip surgery or hip replacement surgery, and she has dislocated that 3 times over, and we're like, my goodness, what are you doing? Is that common?
It is. It depends on the approach that you take for the hip replacement. One of the more common approaches is posteriorly, where you have a small cut on your buttock. Those have a higher dislocation rate. Dr. Boyette and I are just one of a handful of surgeons in Alabama that are trained on the anterior approach. The advantage of that approach is we don't have to cut muscles. We kind of sneak in and around muscles to put the hip in. You get a more stable hip, and in our experience with this, has been a much quicker recovery time.
I would think less pain when you have to skip around those muscles as well.
You're correct. You're absolutely correct.
Do you also do knees?
We do knees as well.
So any knee surgery? Jamie, I know, has had 5 knee surgeries, so he may be a good patient for you.
Lucky Jamie.
Yeah, lucky Jamie. Of course, he had it done back when they didn't have those pretty little scarless ways to do things.
Yeah, now arthroscopy is where we basically make 1 or 2, maybe 3 little poke holes, depending on which part of the body we're working on. And you can work through a very small incision. Obviously, the recovery time is much quicker, and Jamie can probably attest to that if he had some open knee surgeries in the past.
6 weeks.
6 weeks, that's right. If there's anyone out there watching this morning and they've experienced either hip pain or knee pain and they've been kind of leery to contact a doctor to ask them about a procedure, what do you tell someone like that?
Don't hesitate. Come in and talk to us. We're not bad guys.
Not a scary
Unfortunately,
thing.
orthopedic surgeons are merchants of pain, but we can generally make you a lot better.
Okay.
Just don't be afraid.
You know, Brad, if you'll put that picture of Dr. Boyette up as well, you know, some of you may recognize him. He was on the program several months ago, or a little over 6 months ago. He did an interview here with us, so that's good. You guys teaming up. You can give them a call, 233-2332. And again, where are you located?
Corner of Lindsay Lane and Highway 72.
Well, how have you enjoyed the Limestone County area?
I've enjoyed it immensely. Unfortunately, I've not gotten to explore around here as much as possible because my wife and children did not move until June when I came in January. So the weekend that I wasn't on call, I went back to Mississippi to see my wife and children. And since they've moved here, you have the busyness of summer and then followed by sporting events in the fall. So
yeah, their activities don't stop, do they? Whether you're on call or
At
not.
11 and 8, it's amazing how busy they can keep you.
Oh, I
I have a
bet.
question.
Yes, sir.
Who you predicting to win the Alabama Notre Dame game?
Well, Alabama, of course.
He knows
And
what
by
to
about
say.
the margin that you gentlemen were talking about earlier.
Gentlemen, that's the first comment we heard all
I'll
day.
be surprised.
We're going to break him in gently. We won't have to call any of them gentlemen up here this morning.
Like you, I'll be surprised if Notre Dame posts many points at all, if any.
Yeah, well, there you go. All right. I I've been telling Jamie Shirley they'll at least score so he doesn't cry too bad, but I think it'll be good. Well, thank you so much, Dr. Lawrence, for being with us. A website. Do you guys have a website?
We do have a website, orthosportsathens.com.
Wonderful. You can go visit that website. If you need any additional information, feel free to give me a call, 256-603-4848, and we'll get you in touch with Dr. Lawrence. Thank you again for being with us this morning. All right, we're going to take a quick break. When we get back, we're going to eat some burnt cookies and probably decorate them to make them look good. Anyway, right, Jeffrey? We'll be right back. Stay with us.
Feliz Navidad, damn it!